Hello, everyone, and welcome to Triton Benefits and HR Solutions 30-minute webinar entitled How Telemedicine is Transforming Healthcare. We thank you for joining us today. My name is Tina Friedman, Director of Marketing, and I'd like to welcome today's presenters, Melissa Cook, Benefit and HR Specialist for Triton Benefits and HR Solutions, and Paul Goslin, Telemedicine Specialist for Teladoc. With the rapid expansion of innovative technology, we are experiencing a dynamic change in the world of healthcare. From new gene therapy treatments to SaaS systems that enables doctors to capture and share a patient's medical history, to the prompt delivery of healthcare services via the internet or mobile device, the healthcare industry is truly evolving so quickly. While many still believe in the doctor's need to see patients in their office, with the use of optics and virtual reality, they say in the near future physical presence will be much less important. It's an exciting time, and as group health brokers, Triton Benefits is always looking forward to the future to share with our clients and prospects innovative services that can positively impact their employees as well as their bottom line. Today we are happy to have two key presenters that will share insight on how telemedicine is transforming healthcare in 2017 and beyond. Without further ado, let's get started. Please welcome Melissa Cook and Paul Goslin. Turning it over to you, Melissa.
Thank you so much, Tina. Hello, everybody. As Tina mentioned, my name is Melissa Cook, and I am a Benefits and HR Specialist for Triton Benefits. Today, we are very excited to present to you a topic that I know is ever growing in the marketplace called telemedicine. Some of you actually might have heard of telemedicine. Some of you might be thinking, wow, what is this new term? So let's get started. So let's start off with what exactly is telemedicine? Telemedicine is becoming a popular method of providing a variety of medical services. Some employers offer a telemedicine benefit that allows employees to interact with healthcare professionals via the phone, video chat, email, or text for diagnosis. There's also consultations and treatments that follow via telemedicine. So today, close to 200 telemedicine networks and 3,500 service sites currently exist in the healthcare field. Experts are already predicting the industry will reach $3.5 billion in revenue by 2020. That's a huge number, $3.5 billion in revenue. Some of the benefits of telemedicine that, in our opinion, how they help employers today, it gives access to quality and cost-effective health care for your employees. My favorite out of this entire lineup of the benefits is increased employee productivity. So when you think about your employees and when they get sick, you think about the dreaded, how much time are they going to be off from work? First, they have to go to the doctors, right? So they're going to call out sick. Second, they're going to have to go to the pharmacy to go pick up their prescription if they get one. Third, how much time is that doctor going to keep them out of work, and how much is that going to cost you from an employer standpoint of your employees' time? So this product, if that's something that's top of mind for you, that is going to be an area that you're really going to be impressed with the telemedicine product. The other way that you're going to love this is reduced healthcare costs for both the employer and the employee. Employees love this because, A, it's the ease of use, and employers love it because it really doesn't impact your claims at all. It also improves employee morale. And employee morale is improved because it's something cool and new that your employees will love to use, especially for those millennials. If you have any of those millennials that are working for you today, their mentality is they want everything right now. They want to be able to figure out what's wrong with them, they want a prescription, and they want to move on. Some other areas that telemedicine will benefit your employees, specifically if your company is in a remote or rural area, and the doctor might be an hour away, again, goes back to productivity, they will have the ease of use by picking up the phone and making a phone call or FaceTiming with a doctor or doing, something over text message. So that's another really cool feature of the telemedicine. Specialists can be behavioral health specialists, dermatologists, and tobacco cessation coaches. So that's another cool feature of telemedicine. We're going to take a little poll now to see exactly what your familiarity is with telemedicine. Let me know if you can actually see that on your screen. Sure.
Hello, everyone. This is Paul Gosselin. I work with one of the largest telemedicine providers in the country. Or actually, we are the largest. But I wanted to delve into a little bit more about what the effect of employee productivity in terms of cost savings and what it actually costs you as an employer. Through the thousands of employers that we cover with our benefit, we have a study that was done that, according to the Department of Labor results, it's basically 2 hours per incident is what we're saving through telemedicine, as far as 2 hours of productivity at $22 an hour. So when we look at the claims that are saved, first of all, we're trying to redirect these types of services away from your health insurance, so you're having cost savings there. If we can get an emergency room visit at an average of $2,000 out of your health plan by using our services or telemedicine service, look at $2,000 there plus the productivity cost of, let's say that would be $44. So again, it's on average 2 hours of productivity lost each time someone calls or utilizes the telemedicine benefit. And where are we reducing the healthcare cost for you as an employer? It's right there. We're going to redirect folks from unnecessary ER visits, urgent care facility visits, and even the everyday primary care physician. All right. And once your folks use this service, they are going to come out of pocket less. There are 2 different plan designs out there. And one of them would be, you have a copay every time you use our service that the employee would pay, or some of the other vendors might have, when they go to use the benefit, your employees come out of pocket $0. That by far is the most cost-effective and more utilized benefit for your employees, where you're going to see as an employer great employee morale, satisfaction, and cost savings.
Thanks so much, Paul. That was great information. To get back to the poll, we are actually about 50-50. So 50% of the attendees currently offer this to their employees, and 50% actually do not offer telemedicine. So we're about half and half.
Yeah, that's actually a higher percentage than I actually thought it was. I know a lot of you are probably offering telemedicine through your current health insurance carrier. And I want to kind of clear up or kind of describe what the differences might be. So if you're offering it through your health insurance carrier, I will let you know on industry average, you have probably about a 2% utilization factor, meaning if you have 100 employees and you'll have maybe 2 visits to the site. If it's better than that, wonderful. But that's what we see what the industry average is. So it's one thing to say that, yes, we're providing a telemedicine benefit to our folks, and it's another thing to say we're providing an effective telemedicine program where I, as the employer, is saving money, and my employees are really getting a great benefit, and they're using it on a monthly basis. Now, in my experience, with my customers and our company's experience, we have a little bit higher. We're probably at 5% with an embedded product. But if you go directly to, you know what, it's going to be it'll cost you a little bit more on a monthly basis. But if you go directly to the vendor, you're going to see probably on average raising it from 5% to probably 20-25% in your first year. Now, again, that has everything to do with plan design and then communication and marketing to the employees. So again, you can either have yeah, hey, we have it, or you can have a tool that really is a cost savings tool and a valued benefit for your employees.
Hey, Paul. Anthony from New Jersey had a question. He wanted to know, are the doctors employees of the telemedicine company?
Normally, the doctors are not employees of the telemedicine company, which is a good thing. You know, if you're a quality telemedicine vendor, you have a sizable network of doctors that you can utilize. And then the most important thing is they have to be vetted. You know, what's their history? Are they going to give proper attention to the product? Are they capable of following different protocols? So a lot of the carriers out there will vet these doctors properly. They're going to be U.S.-based, trained, licensed, certified U.S. physicians, and they are going to be, if you have a quality vendor, there's not just going to sign them up to do this. There's going to be an ongoing valuation of the services each doctor provides. You know, some of the carriers may even, on an ongoing basis, I know the company I represent will, for the first 3 months, will review 100% of the charts that the doctors, when they first come on board, and then 1 in 10 visits are reviewed. So that's the critical part of providing a quality service, is making sure there's ongoing, ongoing supervision and monitoring of the docs themselves. Okay, and so I guess the next area we want to talk about is what conditions are the most popular. You know, this telemedicine in its form right now, the basic telemedicine program, is not meant to be a replacement of your primary care physician. It's not meant to be used for emergency situations. So if I'm having chest pains and numbness down my left arm, guess what? Don't call your telemedicine provider, get to the ER. But if I've got a head cold, it just won't go away. You know, I have sinusitis. Here are the 10 most common conditions. You know, upper respiratory. You know, it's like people use the ER almost anymore, a lot of times as a doctor's visit, because their doctor's not accessible at the time they need service. And I will tell you right now that the industry average for ER, 63% of all ER visits are for non-emergency situations. And these are the type of conditions that people are going to the ER for. That's where your highest cost savings would be. If we can redirect people from going to the ER, we're going to save you and your employees money. So look at that right there, pharyngitis, conjunctivitis. You know, by being able to access these doctors, either by video, and that's another key. You need a provider that's going to offer the most access to your employees, or your employees to the docs. You want to make sure that the service you sign up with has video conferencing, has the use of, they should have an app on a smartphone. You can use a tablet. But I will tell you also that still in my world, 90% of the calls are still by telephone. And if you think about it, if I'm a young woman, it's Saturday morning, I've had a rough time with a cold for 3 days, I probably don't want anybody looking at me in that condition, right?
No.
So I want to be able to have the ease of calling my doc or calling the service, have a doctor get back to me, usually on average, they get back within a reasonable amount of time, let's say 10 to 15 minutes, and then have those doctors be able to, write a script, to have a discussion, write a script, and then be able to go pick up my script in a reasonable amount of time. That's the beauty of telemedicine. Quality access, easy, cost-effective, quality access to healthcare. So, and these are the top drugs, and let's talk about this. It's getting a little bit different. The basic premise of telemedicine is for chronic, simple conditions, but the telemedicine companies will not provide DEA-controlled substances with their normal general medical programs. They will not provide lifestyle drugs. So those customers that are looking for their weekend, what we call weekend drugs, are not going to be able to use their telemedicine doctors to get that prescription. But let's talk about some. If you look at this top 10 drugs, amoxicillin, Augmentin, Tamiflu, it kind of gives you an idea of who's using the drugs for the most part.
Right.
It's like 65% of visits to a telemedicine provider are really for kids. And the kids could be anywhere from a year old or something like that to whatever, 15, 18 years old. So we in my company, I know that 65% of the visits to our service are parents calling for their children. And then the rest are about, like, let's say, give an example. I had a daughter who went to UCLA out in California for the last 5 years. Yeah, I know, on a 5-year plan, have to pay extra money, all that stuff. But you know what? She wasn't comfortable going to the clinic on campus. And a lot of times the clinic is not open, or it's a really kind of a hassle to get there off hours. So my 22-year-old daughter was on my health plan or on my service provider, which is Teladoc. And gosh, I had her signed up. She went and made a telephone call, called me first, hey, Dad, can I use this out here in California? And I said, absolutely. So she got a prescription for, I want to say it was for bronchitis. And, within a matter of an hour from calling the service to picking up the prescription at the local pharmacy was, less than an hour. Rather than walking across UCLA's campus, finding the clinic, waiting around for a doc, and then getting the medication, she had everything in hand from start to finish within an hour. And I think, Melissa, you had some personal
I did, yeah.
experience with this type of program. How did it work for you?
So I called the doctor. I wasn't feeling well. I knew I had a sinus infection. And I called the phone number, and within 2 minutes, a doctor had called me back, very professional, went through a series of questions, what are your symptoms? Told him my symptoms, and, thankfully, it was something that I've had before, so I knew exactly, what I had. And I think 9 out of 10 times when you use a service like this, you already know that it's either an ear infection, a sinus infection. So within the series of questions, he was able to confirm that, yes, it was, in fact, a sinus infection. He immediately called in the prescription to the pharmacy, and I was able to still get to work on time because I took care of all of this at about 7 a.m., and I called it into ShopRite, and ShopRite had the prescription ready, and I picked it up and had a productive day at work. So it was really easy.
Yeah, that's the beauty of this type of product. Listen, we're not curing cancer. We're not just going to, change a person's lifestyle for health reasons. But what the telemedicine program and industry is trying to do is give folks quality access, again, to effective health care. How about another example of folks where you can use it? Right now, telemedicine is approved in some way, shape, or form in 49 out of 50 states. Now, the only state right now that is not available in is the state of Arkansas. And our Razorback brethren are coming around also. They figured if 49 other states are doing it, we might as well jump on board. So that probably will be in place probably by the end of July, fourth quarter 2017. But give you an example also. Let's say you have a family or one of your employees, they're on vacation. They live in New Jersey. They're on vacation in Florida. What happens, usually I know I took my 3 kids to Disney World, and if one kid gets sick, the next 2 are going to get sick in the next day or 2. So how about having the ability, you don't have access to your doc down there. You don't know where there's an urgent care facility or the ER, and you don't want to go through that hassle. How about being able to pick up the phone and have a doctor get back to you within a reasonable amount of time, be able to talk to you about your children's symptoms, and as long as it's under the realm of telemedicine, what we cover, having them able to prescribe a medication for you while you're down in Florida and attack that illness sooner rather than later and stop it in its tracks before it passes from one child to the other. And oh, by the way, some of the telemedicine providers will help you locate a pharmacy down in the Disney World area. So that's pretty flexible, pretty much an effective tool while you're on vacation. Other instances, let's say you're a business person and you're traveling throughout the country, okay? And I forgot my high blood pressure medicine at home. Well, again, a majority of the providers will allow for a short-term, let's say a 3 to 5 day supply of your high blood pressure medication, things of that effect. They're not going to give you painkillers or, oxycodone or things like that, but those maintenance drugs, to a degree, they'll be able to prescribe for you. And when if I'm traveling from Philadelphia to Houston, I can call when I'm in Houston, and you'll talk to a Texas-based doctor who can supply that prescription, short-term supply. Okay.
Paul, there's a question from Sonia in Texas.
Oh, good.
She would like to know if the services can be used outside the United States.
Great question, Sonia. It's, relatively speaking, it would have to be a situation. The simple answer is no, or not really, unless you're in Mexico. You can get anything over the counter in Mexico.
I bet.
But no, there has to be a U.S.-based doc calling you back. So if you have the ability to talk to a doctor on a U.S., and they can contact you on a U.S.-based telephone, what they can do is they can diagnose and talk to you about what the proper course of action would be, but they cannot prescribe. All right, so they can give you some insight, but they cannot prescribe medication.
Okay, we have some more questions too here. Okay, so, okay, Victor would like to know if is the telemedicine plan supplemental to current employee health plan?
A great question. It would absolutely be supplemental. Okay, so above and beyond what you have. And again, it's the tool that you want to use to redirect claims from your primary health insurance program. It's not going to replace your, it's not meant to be used as a replacement of health insurance, but a supplemental complementary benefit. And here's another thing, at least as far as my company is concerned. We don't want to replace the primary care physician's role in the care of your employees. That's a very sacred role. And you're going to want to look for a carrier or vendor that will share any information, as long as your employee, according to HIPAA, allows it. They can share the information via fax or electronic transfer. Anything they do with your employee or anybody in their family, they can send it over to your primary care and make sure that the relationship with a telemedicine vendor is inclusive and not exclusive. So again, it's a supplemental benefit.
And then Victor had one other question. How is UTI lab handled?
Great question, Victor. I would say that, you know, again, I'm not sure if we're going into we don't get the follow-up information from a UTI lab, but they will basically be able to diagnose and prescribe. Some of the carriers out there, again, this might go into a different, I know we started talking about different coverages that are being added, like behavioral health, dermatology, smoking cessation. Another one out there is sexual health, where that can be provided in a vendor's program that allows for a little bit more privacy for the employee. They might not feel comfortable going through the traditional health plan, and some of the carriers will allow them, they can put into a program for a certain, actually there should be no cost, but on a monthly basis, but they will direct the employees to a clinic in the service area, and the employee would pay out of their own pocket for certain testing done.
Okay.
Okay.
All right, let's talk about now paying for telemedicine.
Yeah, this is getting to be quite a critical subject matter in the world of providing medical care. It's a very important thing to know that telemedicine as an industry has really only been around since 2002, okay? The first telemedicine carrier came around then. They started having first in 2005. But since that time, you know, we are looking at, and this might be even a little bit on the lower end, it says here 34% of employers plan to add telemedicine to their healthcare offers by 2017. And we know, we can see that it's even greater than that. It's getting to be 3 or 4 years ago, telemedicine was kind of a novelty, and now it's becoming a staple in everyone's employee benefits program. So 34%, so if you're looking at that on an annual basis, it's getting crazy. And you know, if you look at this other number, that A benefit for businesses comes in the form of cost savings, and the U.S. employers, and it's really to say that it's going to be projected that we're going to reduce expenses by $6 billion per year by introducing telemedicine technology to their employees. Sounds like an overwhelming number. That's the overall industry, but you as an individual employer, it doesn't matter what size you are, 20 lives to 2,000 to 20,000. If you put a telemedicine benefit in, you will see productivity savings and cost savings to your health insurance program. Now, it's up to you, the vendor, and the consultant to make these programs sing. You can bring a horse to water, but you can't force it to drink. So the vendor that you choose will be the one that can supply superior service, marketing tools, libraries of information that you can supply to your employees and get the word out there. And I will tell you that 95% of the time, there's customer satisfaction, and your employees who use it will go back and use it again. And then once they have that success like Melissa had with her program, it goes from Melissa to Stacy to Rick to Debbie in your offices. And that's how, again, it's an ongoing drip campaign you should be using to make it. It's not a passive benefit. You can't sit back and just let it work on its own. First year, first 2 years, you have to stay involved and get it going. And then after that, it kind of sings by itself. Now, we also have on here the average cost per employee per month of offering telemedicine benefits, depending on the size of your company. You know, $2 on the low end, that's kind of low. $20 is very high, depending on what you're putting in. You know, if you're around a 500-man group, a solid cost would be about, I don't know, let's say $3 to $4 per employee per month. And the other thing you want to be aware of is that again, that's a direct price to a vendor, but you want to make sure if you're paying that, is that just for the employee or does that cover the entire family? All right, so that'd be a real important question to ask. The company that I work for, any price that we give covers a family, not just the employee, but the entire family.
All right, we are getting close to time. Does everyone have another 5 minutes? We have one more slide, and then time for Q&A at the end. I know, Victor, I saw your next question. If you don't mind, we're just going to finish up this last slide, and then we'll take questions at the end. Now we're going to talk, Paul, about the future of telemedicine.
Yeah, it's pretty exciting. You know, there's there's stats out there like this one here. It's kind of scary. 90,000 medical practitioners we're going to lose within 5 years. So that means access to healthcare is going to be greatly reduced, especially for those folks that live in rural areas. So let's get going with technology and access through technology for those employees. Listen to this one. 2014, the global telemedicine technology industry was valued at almost $18 billion. Listen to this number. Wouldn't you love to have your business grow like this? 18.4% growth each year from now through 2020. So
not bad.
As we see, it's getting more and more entrenched. People are looking for alternative ways to keep their healthcare costs down, and this is a real valuable tool to help those healthcare costs. You know, we're not, again, like I said, we're not going to cure cancer, but we're going to help your folks and you save money and provide quality care.
Yes. If you have any questions, please direct them to the question box on the side panel. I know Victor had a question, Paul. He wanted to know, is there any way to automate telemedicine services with primary care provider patient records?
If I understand that question properly, we do not have access to the primary care physician's records for that employee. The only thing that we can do is supply that primary care physician anything that we will do with that employee. Now, and that's standard operating procedure for most of the vendors out there. And we keep an ongoing electronic medical records for each employee. When they register, it's going to be, medical history, personal contact information, medical history, and prescription drug history that we're going to keep on an ongoing basis. And we ask the employees to update their file every year. But as far as tying into the records that the primary care physician has on each employee, they are not going to turn that over to us due to HIPAA and privacy.
Okay, we have another question from Rob. Rob would like to know, how does malpractice insurance work for a multiple state practice?
The only way I can answer that for you, Rob, is this, that each of these practitioners, as far as, again, it may go, you know, by vendor, but as far as I'm concerned, the best vendors they will carry malpractice insurance as an umbrella policy over each of their practitioners. Now, the practitioners themselves usually are, you know, they might be licensed in each state, and they carry their own, depending on, you know, how many states they have their license in, because they do have to have a license in, let's say, New Jersey. If they're going to practice in New Jersey, they have to have a license, and we'll only use New Jersey doctors, licensed doctors, for New Jersey residents. So they're going to carry their own malpractice insurance for each state, and then a telemedicine provider would be carrying an umbrella policy over their policies. And I know with my particular carrier, it's a $3 million umbrella policy that is placed on top of the personal physician's policies themselves. And it has to be specific to telemedicine.
All right.
Hopefully that answered that question.
Let's see if I have any more questions. I think that was all the questions. I wanted to wrap up by saying thank you so much for attending today's webinar. Wanted to see if anybody is interested in setting up a follow-up call to discuss if you have you know, other questions that you didn't get a chance to ask today. We're more than happy to answer any questions that you have. Further, you know, I guess more in depth. Also, wanted to let you know that in the handout side on the sidebar, I did put a copy of today's presentation. There will also be a recording of today's webinar on our website, which is tritonhr.com, and a copy of the PowerPoint will also be on our website. But that concludes today's webinar. Thank you so much, Paul, for being our special guest.
Thank you for having me. It's been a lot of fun. I appreciate it.
Yep. Have a great day, everybody.